Welcome to George Campus. Imagine a common scenario. A breastfeeding mother presents with urgent dental needs, but concerns about local anesthesia and infant safety lead to postponed treatment or unnecessary anxiety. For too long, limited data on drug transferring to breast milk has created a dilemma for both patients and providers. But recent clinical research is shedding new light on the safe use of Articaine in this vulnerable population. This video will bridge the knowledge gap, providing you with evidence-based insight to confidently manage dental care for breastfeeding mothers. Stay tuned to empower your practice and enhance patient well-being. Now let's delve into the core of the research and understand the current landscape of Articaine safety. Understanding the challenges, limited data, and patient anxiety. Historically, information regarding the transfer of gentle local anesthesia, particularly Articaine, into breast milk and its potential effect on breastfed infants has been scarce. The lack of clarity often leads to healthcare providers and patients opting to forego anesthesia, postpone essential dental work, or even temporarily discontinue breastfeeding. These cautious, yet often unnecessary, approaches can unfortunately worsen dental conditions and cause significant anxiety for new mothers, impacting both maternal and infant health. Addressing these critical questions regarding safety risk to infants and the optimal timing for resuming breastfeeding is paramount for dentists to develop appropriate and empathetic treatment plans. The research breakthrough unveiling Articaine's pharmacokinetics. A recent clinical lactation study aimed to evaluate the safety of Articaine in breastfeeding mothers by thoroughly examining its pharmacokinetic properties in breast milk and assessing potential risks to breastfed infants. 12 breastfeeding mothers received a standard 68 mg dose of 4% Articaine via supraperiosteal infiltration. The findings reveal that the peak concentration of Articaine in breast milk occurred rapidly, at approximately 0.25 hours, reaching about 256.5 nanogram per milliliter. Significantly, this concentration then declined to 12.9 nanogram per microliter by 3 hours post-administration. The total amount of Articaine transferred to breast milk after 3 hours was calculated to be a minimal 1.12 microgram. This detailed pharmacokinetic analysis provides crucial insight into how Articaine behaves in the lactating body. To robustly assessing infant safety, the study utilized physiological-based pharmacokinetic or PBPK modeling. This advanced technique allows researchers to predict infant plasma exposure to Articaine based on the observed breast milk concentrations. The model predicted that the maximal plasma exposure in infants was exceptionally low, at just 0.19 nanogram per milliliter. To put this into perspective, this predicted infant exposure is far below established toxicity thresholds, including the reported cardiotoxicity threshold of 6,200 nanogram per milliliter in human. In fact, the 1.12 microgram of Articaine transferred equate to a mere 0.05% of the threshed safety dose of 5 microgram per kilogram for pediatric patients. Clinical implication: resuming breastfeeding with confidence. The robust findings from this study suggest a clear and reassuring path forward for professional healthcare providers. Breastfeeding mothers can safely resume breastfeeding within 1 to 3 hours after receiving an intraoral injection of 68 mg of Articaine. The predicted infant exposure is consistently and considerably below concentrations that will produce any pharmacological effect, let alone toxicity. This evidence clarified the safety of using Articaine in breastfeeding mothers and provides optimal timing for resuming breastfeeding after dental procedure. By incorporating these findings into your practice, you can ensure painless dental practice for breastfeeding mothers while alleviating their concerns and reducing clinical risks. In summary, this clinical research provides strong scientific evidence supporting the safe use of Articaine in breastfeeding mothers. The minimum transfer of Articaine into breast milk and the negligible predicted infant exposure mean that you as a healthcare professionals can confidently administrate Articaine for dental anesthesia without undue concern for the breastfed infant's safety. This empowers us to offer essential dental care to mothers without anxiety of interrupting breastfeeding. Continue to prioritize data-driven decisions for the well-being of both mothers and infants. Thank you for watching.